Hello, I'm Rikki Priest. I'm a mother, a daughter and a friend, as well as an educator and doctor. And today is Crazy Socks for Docs Day, and I'd love to share with you a bit about how Crazy Socks for Docs started, as well as a snapshot of my own mental health story and 5 practical steps that you can take to be part of the campaign and make a difference. It's a day that started here in Australia and has become an international movement. It's an awareness raising event and social media campaign that aims to destigmatise conversations around mental health amongst healthcare workers. Dr. Jeff Toogood is the founder. He is a consultant cardiologist in Melbourne who has a lived experience of mental illness and has experienced unnecessary discrimination and stigma. When Dr. Jeff Toogood experienced severe depression, he'd wear really bright, colourful socks as a simple little gesture to try to lift his mood. His puppy, Sammy the Golden Retriever, was a little sock thief, and one day Jeff only had odd, unpaired socks. At this stage, he was recovered and in remission. However, the Technicolor odd socks resulted in whispers and conjecture behind his back because of the stigma and the lack of understanding that still exists around mental health and illness. He used the story with the hashtag Crazy Socks for Docs in a social media support group, and the post went viral. I too have a lived experience of mental illness. The first time it impacted me was after the birth of my baby girl, and it was a colleague who didn't know me very well at the time who reached out with compassion to ask, "Are you okay? I've noticed a few things that are out of character." And it's moments like these that are the sliding door moments that save lives. Here are a few things that I think you, as the doctors of tomorrow, and I can do that can help create the change that we need. And 1, the easiest one, wear crazy socks on the first Friday of June. 2, check your own stigma. You will come across the beast that is mental illness either directly or indirectly. The research shows at least 1 in 3 doctors are impacted by mental illness, and it's even higher in medical students. 47% of female medical students and 36% of male medical students. So in a class of 100, around 4 will have had previous suicide attempts, and 1 in 5 will have had suicidal ideation within the last 12 months. If you are less likely to seek help for yourself, or if you see your own mental illness as a weakness, research consistently shows that you are statistically more likely to judge others and to agree with stigmatising statements such as doctors with mental illness are perceived as less competent, achieve less, or should be able to avoid becoming depressed, are less reliable, or are less likely to progress in their career. And these are part of an unhelpful narrative, so please check your own stigma and leave it at the door. Number 3, get involved in organisational improvements and advocacy. Organisational and workplace issues are a huge contributing factor to mental illness and burnout. If you notice something at work or at uni that is a systemic issue contributing to burnout, dissatisfaction or poor mental health, speak up and say something, offer alternatives and suggestions. I want to acknowledge also that Crazy Socks for Docs is not a good day for some students and clinicians. It can be extremely triggering, especially where individuals have felt stigmatised or unsupported by their organisations. So look out for each other and find ways to improve systems so that we can be the best doctors, leaders and learners that we can be. 4 is to be part of the story. Sharing stories or uplifting others who are sharing theirs is a really powerful way to change our culture. There is a time and a place. There needs to be space and time to heal. You could like and share this post or share posts from the And Me campaign or the Humans and Medicine page by Worms. Number 5, have the I see you, I noticed, and are you okay chats, and then just listen. There are some great resources on mental health first aid. Knowing a few simple steps to offer is a great tool to have in your belt, and you definitely don't need to have all the answers, just listen. There are many great resources out there. Your own GP is a start. The Doctors Health Advisory Service of Western Australia, DHASWA, is also one of those resources. You can access a free and confidential 24-hour support line, and there is a great resource on their website which is a list of GPs, psychiatrists and psychologists who have expressed a keen interest in seeing doctors and medical students as a priority. This little video has been put together for West Australian medical schools, and a special thank you to Ha Nguyen from Sediness Productions for her videography. So I hope you're wearing your crazy odd socks today. It's important that we celebrate how far we've come when it comes to lighting the stigma on fire around mental health and illness. On behalf of the DHASWA committee, thank you for your time today. So join the conversation because mental health matters.